Hi everyone, this is Nurse Anna from NurseStudy.net. In today's lesson, we're going to talk about Parkinson's disease, a chronic progressive neurological disorder that affects movement. By the end of this video, you'll understand what's happening inside the brain, why the symptoms occur, how nurses care for these patients, and what to prioritize when creating a care plan. We'll also go through nursing diagnoses, interventions with rationales, complications, patient teaching points, and finish with 5 NCLEX-style practice questions to test your knowledge. Don't forget we have study guides and free audiobooks available in our store. The links are in the description below. Pathophysiology, simplified. Let's start by breaking down what's really going on in the body. Parkinson's disease happens when certain nerve cells in the brain, especially in an area called the substantia nigra, begin to die off. These nerve cells are responsible for producing a chemical messenger called dopamine. Dopamine helps transmit signals that control smooth, coordinated muscle movements. When dopamine levels drop, the brain loses balance between dopamine and acetylcholine, another chemical that helps control movement. Think of it like driving a car. Dopamine is the brake and acetylcholine is the gas. Without enough dopamine, the brakes fail and the muscles move too much or in a jerky, uncoordinated way. This loss of dopamine causes the classic symptoms of Parkinson's: tremors, stiffness, and slowed movement. Over time, the disease affects balance, coordination, and speech. While the exact cause isn't fully understood, scientists believe it involves a mix of genetics, aging, and environmental exposures to toxins. Signs, symptoms, and labs. The symptoms of Parkinson's develop slowly and get worse over time. The most common early signs include tremor at rest, usually starts in one hand like a pill rolling motion between the thumb and fingers. Bradykinesia, this means slow movement. Patients may take longer to start or complete movements, making daily tasks difficult. Muscle rigidity, muscles become stiff and the face may look expressionless or masked. Postural instability, problems with balance that increase the risk of falls. Shuffling gait, patients often take small quick steps and have difficulty stopping or turning. Other signs may include drooling, difficulty swallowing, soft voice, depression, and sleep problems. Diagnostic tests. There's no single lab test for Parkinson's. Diagnosis is mostly clinical, based on signs history and ruling out other causes. However, imaging tests like MRI or PET scans may help rule out other brain disorders. Sometimes a positive response to dopaminergic medications like levodopa supports the diagnosis. Nursing care plans. Let's go over 3 nursing diagnoses and their related interventions, including rationales. Nursing care plan number 1. Nursing diagnosis: impaired physical mobility related to muscle rigidity and bradykinesia as evidenced by difficulty walking and shuffling gait. Interventions and rationales: encourage active and passive range of motion exercises. Rationale: maintains joint flexibility and prevents muscle contractures caused by immobility. Assist the patient with ambulation using assistive devices. Rationale: promotes safety and independence while reducing fall risk. Encourage the patient to take small steps and keep the feet apart when walking. Rationale: improves balance and stability, reducing postural instability. Collaborate with physical and occupational therapy. Rationale: therapists can teach specific exercises and adaptive techniques to maximize functional ability. Expected outcome: patient will demonstrate improved mobility and perform daily activities safely with or without assistance. Nursing care plan number 2. Nursing diagnosis: impaired verbal communication related to decreased muscle control of speech as evidenced by soft, slow, or slurred speech. Interventions and rationales. Allow extra time for the patient to respond during conversations. Rationale: reduces frustration and promotes effective communication. Encourage the use of communication aids such as writing boards or smartphones. Rationale: helps express needs and maintain social interaction despite speech difficulties. Refer to a speech therapist for exercises that improve articulation and volume. Rationale: strengthens facial and vocal muscles, improving clarity of speech. Encourage family participation during communication. Rationale: enhances support and understanding between the patient and caregivers. Expected outcome: patient will express needs and feelings effectively using speech or alternative methods. Nursing care, plan number 3. Nursing diagnosis, risk for injury related to postural instability and unsteady gait. Interventions and rationales. Keep the environment free from clutter and remove loose rugs or cords. Rationale: reduces the risk of tripping and falling. Encourage the use of non-slip shoes and proper lighting in all rooms. Rationale: promotes safety and improves visibility. Instruct the patient to change positions slowly. Rationale: helps prevent dizziness or orthostatic hypotension. Ensure call light and frequently used items are within reach. Rationale: reduces unnecessary movements that could lead to imbalance. Expected outcome: patient will remain free from falls or injuries during hospitalization or at home. Complications and nursing priorities. Parkinson's disease can lead to several complications, including falls, aspiration pneumonia, pressure ulcers, depression, and medication side effects. The biggest nursing priorities are to ensure safety, maintain mobility, prevent aspiration, and monitor for medication effects. When prioritizing care, remember ABCs: airway, breathing, and circulation. Difficulty swallowing could compromise the airway, so always monitor for choking or coughing while eating. Patient teaching points. Take levodopa carbidopa, Sinemet, exactly as prescribed. Avoid high protein meals right before or after taking the medication, since protein can reduce absorption. Report uncontrolled movements or dizziness to the provider. These can be medication side effects. Eat high fiber foods and drink plenty of fluids to prevent constipation. Use adaptive utensils, grab bars, and raise toilet seats to increase independence. Maintain a regular exercise program such as walking, stretching, or yoga to improve mobility and mood. Join support groups to help cope with emotional challenges. NCLEX-style practice questions. Question 1. A patient with Parkinson's disease is having difficulty initiating movement when trying to walk. Which intervention should the nurse recommend first? A. Encourage the patient to rock side to side before stepping. B. Remind the patient to walk faster to prevent freezing. C. Ask the patient to take very large steps. D. Suggest the patient look at the floor while walking. Correct answer. A. Encourage the patient to rock side to side before stepping. Rationale: rocking from side to side helps the patient overcome freezing of gait by shifting weight and triggering movement. B is incorrect. Walking faster worsens the risk of falls. C is incorrect. Large steps decrease stability and increase fall risk. D is incorrect. Looking at the floor reduces awareness of surroundings and increases fall risk. Question 2. The nurse is teaching a patient taking carbidopa-levodopa. Which instruction is most important to include? A. Avoid taking the medication with high protein meals. B. Eat high sodium snacks to prevent dizziness. C. Stop the medication if nausea occurs. D. Take the medication only when symptoms worsen. Correct answer. A. Avoid taking the medication with high-protein meals. Rationale: high-protein foods interfere with levodopa absorption, reducing effectiveness. B is incorrect. Sodium does not prevent dizziness. Hydration and slow position changes do. C is incorrect. The patient should not stop medication abruptly. Contact the provider instead. D is incorrect. Levodopa must be taken on a regular schedule, not as needed. Question 3. The nurse observes a Parkinson's patient drooling and coughing while drinking water. What should the nurse do first? A. Stop oral intake and notify the provider. B. Thicken all liquids. C. Place the patient in an upright position. D. Offer small bites of solid food. Correct answer: C. Place the patient in an upright position. Rationale: positioning at 90 degrees helps protect the airway and reduces aspiration risk. A is incorrect. Stopping intake may be needed later, but airway protection comes first. B is incorrect. Thickened liquids may be necessary, but only after proper assessment. D is incorrect. Solid food does not resolve the immediate risk and may worsen aspiration. Question 4. A patient with Parkinson's disease is at risk for falls due to postural instability. Which home modification is most appropriate? A. Keep floors lightly waxed for smoother walking. B. Install grab bars in the bathroom and hallways. C. Place small rugs to prevent slipping. D. Encourage walking in dim lighting to avoid overstimulation. Correct answer: B. Install grab bars in the bathroom and hallways. Rationale: grab bars help with balance and prevent falls in high-risk areas. A is incorrect. Waxed floors increase slipping risk. C is incorrect. Small rugs are trip hazards. D is incorrect. Dim lighting increases the risk of falling. Question 5. A patient taking levodopa reports new involuntary jerky movements of the arms. What is the nurse's priority action? A. Check when the last dose of medication was taken. B. Increase the next levodopa dose. C. Tell the patient this symptom is expected. D. Encourage deep breathing exercises. Correct answer: A. Check when the last dose of medication was taken. Rationale: involuntary movements may indicate dyskinesia, often related to peak levodopa levels. Assessing dose timing helps determine whether the provider needs to adjust the dose. B is incorrect. Increasing the dose could worsen dyskinesia. C is incorrect. It is not a normal finding, requires assessment. D is incorrect. Deep breathing does not address the underlying medication issue. Let's review what we learned today. Parkinson's disease is caused by the loss of dopamine-producing neurons in the brain. Classic symptoms include tremors, rigidity, bradykinesia, and postural instability. Nursing care focuses on safety, mobility, and effective communication. Medication management and patient teaching are vital to improving quality of life. This is Nurse Anna from NurseStudy.net. I hope this helped you understand the pathophysiology and nursing care for Parkinson's disease. Visit NurseStudy.net for study guides, care plans, and NCLEX practice questions. Keep studying smart, and I'll see you in the next lesson.